Hey, I'm Dr. Ashley DeMarco of Gulfside Dental joining us now. How are you doing today?
I'm great. How are you?
Good to have you. And today we're talking about something that really is going to appeal to a lot of people because from time to time you may not realize when you're going to need this, but we're talking about crowns.
Exactly, crowns. And a lot of times people don't know why you need a crown instead of a filling and what, cases crowns are indicated and that type of thing.
So why is a crown needed instead of a filling?
Well, there's multiple reasons, but the biggest reason is if the filling is too big, that the tooth will be protected from just the filling. So if you think we put a big filling in and that's where you now bite, if the remaining amount of tooth is less, than how big the filling is, the tooth is no longer protected and we need to put a crown around the whole tooth to protect it.
The crown really just means that it goes over your entire tooth then?
Correct.
Okay.
It sure does.
So that makes sense to protect it more. And what if, you always hear the horrible root canal, people get scared about that, but what do you need, when do you need rather, a crown versus a root canal?
Okay, so if you need a root canal, you usually need to have a crown put over the root canal when it's done. Now,
Okay.
and having a filling versus a root canal is when the cavity that you have has gotten big enough that it gets into the nerve. If it gets into the nerve area, it's now infected that nerve, and we have to take the nerve out and clean down around the nerve and put a filling all the way. Basically, a root canal is just a filling that goes all the way to the end of the nerve, or the end of the root of your tooth.
Okay, so you're cleaning that out then.
We clean that out, and so the tooth is at that point dead because it no longer has a blood supply or a nerve, and because of that, just like if your skin no longer had blood supply, the tooth becomes brittle and is a lot drier and in some ways is weaker. So we
Okay.
put a crown on top of root canal treated teeth to protect it as well.
Okay, so you always do that then. That would be the case. If you had a root canal, you're going to get a crown over that.
Pretty much. There's some exceptions if it happens in one of your front teeth and it was because you needed a root canal, maybe because the tooth was injured and not because of a cavity. There are a few exceptions, but for the most part, if you need a root canal, you're going to need a crown over it to protect the tooth.
Simply to protect it.
Exactly.
And what about an extraction versus maybe when can you get a root canal? I guess is it not as severe if it becomes more severe when you need an extraction? Maybe?
Right. Well, so there's always the option, usually, to either have, you can have an extraction done instead of a root canal.
Okay.
However, a lot of times we always remind patients that once we take that tooth out, it's gone. So if we can try to save it with the root canal, that is your best bet. If for some reason the root canal fails a few years later, we can always take it out. But we would like to, and a lot of times it is the best option for the patient, to go ahead and have that tooth root canal treated, and then if there's a problem later, it can be taken out.
And honestly, you probably really want to try to do that, right? Save your tooth because that can affect you, of course, in the future.
Right. It can affect a lot of things. It can affect other teeth around your jaw, and it can make your whole jaw collapse, so it's important to try to save them. But there are some situations where the cavity is so bad that a root canal can't even fix it, and the tooth does have to come out.
Now, of course, going to the dentist regularly helps you curb things like that, but also
Right.
maybe, we've talked about this before, Dr. DeMarco, if people are thinking, I'm too nervous, I haven't been in a while. Really behind, you coming on here with these tips for us, helping us out, it's really to just kind of take away that fear so people
Right.
just go to you, of course, and say, look, this is what it is, can we figure it out?
Exactly. And people they come to our office, and when they hear they need a root canal, it seems like we told them that they had something terrible that they needed.
Yeah.
It should not be a painful procedure. The tooth in the gums around the area should be completely numb, and if there's any pain during the procedure, as long as you let the dentist know, we can make you comfortable and make sure that you shouldn't have a lot of post-operative pain or pain during the procedure.
And we have your information on the screen, so the best thing is that just give a call and figure out maybe an appointment time.
Right, and just remember there's no problem or anything that seems too big that we can't help you, and most of the work that we can do is not completely painless, but we do it with as little pain as we possibly can.
Great. Thank you, Dr. Marco. We
Thank you.
appreciate that as always.